Welcome to Addiction Group's podcast, where we address pressing questions about addiction. Our goal is to provide insight and guidance for those seeking answers. I'm your host, Anna. Welcome to another episode of Addiction Group's podcast. Today we have a very special guest with us, Ben, who is an expert on alcohol addiction and treatment. Hi, Ben. How are you today?
Hi, Anna. I'm doing well, thanks. It's great to be here to discuss such a critical topic.
Let's dive right in. Ben, could you start by explaining to our listeners what alcoholism or alcohol use disorder actually is?
Absolutely. Alcohol use disorder, commonly referred to as alcoholism, is a chronic brain disease characterized by an inability to stop or control alcohol use despite negative social, occupational, or health consequences. It's marked by an intense craving for alcohol and often involves a physical dependence on the substance.
So it sounds quite serious. Is it safe to say that alcoholism can affect virtually anyone?
Yes, it can affect anyone regardless of their background. There's no single cause, but a variety of factors like genetics, environment, psychological, and social factors all play roles in the development of this disorder.
How is alcohol use disorder diagnosed?
Professionals use the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, which contains 11 criteria related to behavioral changes and warning signs of alcohol problems. If a person meets at least 2 of these criteria within a year, they may be diagnosed with AUD.
What types of behaviors or changes might indicate someone is battling with AUD?
Well, it can range from spending a lot of time drinking or recovering from drinking, to failing to adhere to one's own limits on alcohol use, experiencing cravings, or continuing to drink despite knowing it's causing you harm, among other signs.
That's interesting. How does the DSM-5 classify the severity of AUD?
AUD is categorized into mild, moderate, or severe based on the number of symptoms present. Mild AUD involves 2 to 3 symptoms, moderate involves 4 to 5, and severe is indicated by the presence of 6 or more symptoms.
Now, when it comes to alcohol consumption, what would you say constitutes too much?
That's a bit tricky since the effects of alcohol can vary widely from person to person. Factors like how much and how quickly you drink, your mood, metabolism, and even your genetics play roles in how you handle alcohol.
Can you tell us what's considered a standard drink?
Sure, a standard drink in the US contains about 14 grams of pure alcohol. Despite different drink types and sizes, this measure helps to quantify and compare their alcohol content.
Are there any guidelines for what's considered moderate or low-risk drinking?
Certainly. For example, moderate drinking as per the dietary guidelines for Americans means up to 1 drink a day for women and 2 for men. The NIA defines low-risk drinking as no more than 3 drinks on any single day for women and 4 for men, with weekly limits as well.
What about binge drinking and heavy drinking? How do they fit into the picture?
Binge drinking is essentially drinking that spikes your blood alcohol concentration to 0.08% or above in a short period, typically in about 2 hours. Heavy drinking, on the other hand, involves binge drinking on 5 or more days in a month.
Are there individuals who should avoid alcohol completely?
Absolutely. For instance, anyone under the legal drinking age, individuals with certain medical conditions, pregnant and breastfeeding women, and those taking medication that might interact negatively with alcohol should abstain.
Discussing the risks associated with AUD, can you touch on short-term and long-term health risks?
In the short term, risks can range from hangovers and memory blackouts to injuries and violence. Long-term excessive alcohol use can lead to serious health problems, including chronic diseases, mental health disorders, and a range of social issues.
It sounds like alcoholism can have some really serious implications. Before we wrap up, Ben, what advice do you have for someone who might be struggling with alcohol use?
I would say don't hesitate to reach out for professional help. Alcoholism is indeed serious, but it is manageable with support and appropriate treatment. No one has to go at it alone.
Thanks for that, Ben. And thank you for sharing your knowledge with us today. It's been enlightening, and I'm sure our listeners have learned a lot.
It's been my pleasure, Anna. Thanks for having me here to talk about this important issue.
Thank you for tuning into Addiction Group's podcast. We hope our discussions bring clarity to your queries about addiction. Remember, we're here to support and guide you. Until next time, stay informed and stay strong.